it's Maddie. Welcome back to my channel. And again, I am filming in my actual bedroom because the guest room is still needing to be cleaned up. But anyways, I am going to share with you a little bit about Cariology, which is a class that I took over January here. My program does 2 of our program courses over January. First year does Cariology, which is basically the study of cavities and tooth decay and kind of that process and how that happens, to recognizing signs of decay, to the treatment protocols we use for our patients in clinic if they may have decay, how to understand how fluoride helps with decay, applying things clinically, checking for cavities clinically, stuff like that. First years take Cariology, and then my second year I will take dental anxiety and pain management, which is learning how to do local anesthesia. So second year is having fun with that right now. I was actually talking to some second year, and they did like 9 injections at one point in their mouth, and I'm kind of like, oh, good grief. But anyways, I will give you a little bit of a rundown of Cariology, kind of what we did, and kind of why we do it ahead of time. So first of all, a lot of dental hygiene programs will do this usually like second semester of dental hygiene school in conjunction with the other classes. However, we have like 4 other classes. We have Fluorosis 2, we have periodontology, general oral pathology, and dental health nutrition. So to add this on top of that would be kind of difficult. So I'm kind of glad my program does this kind of accelerated and does it in between time. And as a matter of fact, a lot of the stuff we're learning now is actually helpful because I would rather know how to test a pH level in someone's mouth and understand how to do a caries risk assessment on a patient before I actually treat a patient, not while I'm treating patients, so that it makes sense to me, and then I'm not going to be like scrambling, like how do I do the provisor score, how do I do the pH level, and all these different things. So I'm very glad we're doing it ahead of time, and we did it in an accelerated format, meaning that a lot of the material was online, and then we met 3 times in January face-to-face. As a matter of fact, I have one more class, but it is just our final presentation and our finals. All the other work is done. It was actually a really enjoyable class, and I really liked the teacher who taught it, and I'm glad she taught it. So anyways, the book we used was Primary Preventative Dentistry, and this book actually had a lot of useful information. I actually really like that it showed a lot of pictures clinically. I also love that it gave a lot of history behind how they discovered that fluoride was really the all-time best time thing to really help prevent cavities in children and adults and in general. This book was extremely good with identifying those different things, and I actually think this book will be very, very helpful as we go forward into like doing sealants and stuff like that, and understanding fluoride applications, which we actually did do the first week. We applied fluoride on each other and checked for cavities on each other, using in a different type of an Explorer, which was super fun, and I like the clinical side of this kind of stuff. I didn't think I would at first, but I really liked understanding like why cavities form and kind of the different things behind it. Someone did comment on Beyond Type 1. Somebody made a post saying, every time I go to the dentist, no matter what I do, I seem to get cavities. And somebody tagged me and say maybe I could help kind of explain my side of the story. And there's a lot of different components as to why people get cavities and some people don't. And I'm going to delve into that more in detail and really explain the diabetic side behind it, because there's a lot involved with diabetes care and cavities. My first instinct is if you're using a lot of sugary, acidic foods to treat low blood sugars, like juices, and you don't brush your teeth after, you are basically putting your teeth under an acid attack. And acid attacks last 20 minutes, and if you're constantly sipping on stuff, your teeth are constantly being put under that acid. So that just inhibits those bacteria to continue to ferment these carbohydrates, and in turn squirt all this acid and keep your environment acidic, which leads to demineralization. Which demineralization doesn't necessarily cause cavities, but once you start that demineralization process and you keep adding to it and you keep allowing that plaque and bacteria to grow on the teeth, that is what can eventually lead to cavitation and wear on that tooth enamel. You can even get cavities on the roots of your teeth and stuff like that. So another thing we did in Cariology was look at different x-rays and be able to recognize the radiolucencies and decay on different x-rays. Now, as dental hygienists, we cannot diagnose cavities or caries. We cannot diagnose that. But we can kind of get an idea and say, to the patient. The patient might ask us, do we have cavities? And you have to word yourself very clearly. You could say, well, I honestly can't tell you that, but I can tell you this restoration on this tooth is concerning to me, and I'm going to have the dentist take a further look at it. Or you can say, I was feeling around in your mouth and there's a little area that's a little bit soft. I'm going to have the dentist take a look at it and make sure that you don't have anything starting. You can't exactly say, oh, yes, for sure it's a cavity, even though deep down inside you're probably like, yes, it's probably a cavity, and they're going to need to have a restoration placed on that tooth to stop the caries process. But I'm kind of glad we got to do that so that we could kind of get an understanding of like how this instructor interprets it to her different patients. Now, she still works clinically, which is super duper nice, and she just fills in different parts of my program wherever they need her, which is nice, and she said she loves everything to do with it. So I really appreciate her clinical background and all the different experiences she shared with us. But that's another thing we kind of have to watch, is that we can look at the radiographs, but understand that we can't say, yes, for sure you have cavities or you have caries. We could say there's an area that concerns me, there's an area that doesn't look quite right on the x-ray. I'm going to have the dentist take a further look at it. A dentist can diagnose cavities. So this is the binder I use for Cariology. I made a really cute little tooth with decay on it, and I put J-Session and Maddie, and I just used a 1-inch binder, and it seemed to work perfectly, and then I actually just slid my book right on top. And there was really a few main sections that we did. Like I said, most of this material was online, so we'd get certain assignments, have to turn in online, and then we met face-to-face like 3 different times. Like I said, as a matter of fact, I have one more class, and we're doing a presentation and a final exam, which is fine. My group did, our presentation is going to be on Xylitol, which is a sugar alcohol, and kind of how it helps prevent cavities from forming or progressing kind of thing. So that'll be a very interesting thing, but these are some of the examples of the assignments we've done. This is like Learning Plan 3 that we turn in next week. For our group project, I'm going to try to cover names up here. We had to do like a study guide for Xylitol, and then like basically, you know, we have to give this to the class while we present our PowerPoint, and we also made a poster board, and what's super cool is like we had to do something engaging with the class, so I ordered sugar-free or Xylitol suckers, and they're super cute. They're shaped like teeth, and they're very minimally impacting on blood sugar. And again, I'm going to talk about this in the future because Xylitol is huge for you diabetics. Sugar alcohols are one of our best friends that we can have, because they don't really respond the same way in the body and on blood sugars as regular glucose or fructose or sucrose. So I'll talk about that further, but I was kind of excited that we got Xylitol for a project. And then in this front cover, I just kept the syllabus, which is basically a rundown of the different things that we learned. Week 1, like I said, we just did cavity detection on each other and placed a fluoride varnish on each other. We actually have a fluoride varnish that is way different than the one that I've been used to getting on my teeth, and it's kind of like a paint-on, and you only paint it on the sides of the teeth that touch the inside of the cheeks, and then it seeps into the rest of the tooth surfaces, which is super duper cool in my opinion. That like the stuff that I'm used to is a really thick gel-like substance, and they brush it everywhere, and it makes your mouth feel like you've got gunk everywhere. So we got to do that, and then we also have to really understand the rationale behind why you would give somebody a fluoride treatment, because not everybody really needs a fluoride treatment. There's a lot of people that would qualify. Kids and adolescents are a great example. People with high cavity risks, people with a lot of plaque, people with faulty restorations, children and adolescents mainly because of the fact that their teeth are still erupting. And when the teeth erupt into the mouth, they actually have a couple more years before that whole entire enamel surface of the crown matures. And if that crown level or the enamel in the crown isn't quite mature, it's not going to be as protective against cavities. We talked about like sealant placements. Those actually help prevent cavities in what we call the grooves and the pits that are in the back teeth. They're kind of like, when your molars kind of form, they kind of form like this, and they leave little pits and fissures. And these little areas, if you could see, like imagine that triangle, are very, very prone to getting bacteria and plaque buildup in there because it's really, really hard to get a toothbrush in there. So by filling that with a sealant, imagine that you're going to put a sealant in between this crack, you basically are not allowing that bacteria to get in there, and it's just kind of like preventing things, and it makes a nice smoother surface for a person to clean, makes it easier to keep clean so that cavities don't form into those pits and those fissures. So we really had to learn the different rationales behind that, and like if any of the patients I treat and I want a fluoride treatment, I have to present a rationale to either one of my instructors or the dentist and explain like, hey, you know, I did a plaque score on this patient, it was really, really high. I noticed that there's some demineralization present on X teeth. I was talking to the patient, and their fluoride levels at home aren't adequate. I've got a child here who likes to eat a lot of sugary drinks and eat a lot of sugary snacks and drink a lot of sugary drinks on a regular basis. So those are good people that qualify for fluoride treatments. But fluoride treatments are very, very beneficial. So as long as you can present a reason why you need a fluoride treatment and it's legit, obviously you're going to get one for your patient. And again, fluoride in small quantities over a long period of time is ideal. You can overdo fluoride, which I will talk about in a minute, which we learned like week 2 and week 3. But that was mainly the first week, is understanding like how to detect cavities, how to place fluoride on the teeth, and doing a pH test of the oral cavity. Your oral cavity should be at a neutral pH of like 7.0 to 7.5, or even a little bit basic. You're getting into that basic level once you get above 7.0. Every time you eat something really acidic or super sugary, your pH level will drop, and your body will have to try to return it to the resting pH. If you keep your pH super acidic in your mouth for long, that is going to prolong things and make things at a higher risk for you to get demineralization and eventually lead to caries. So we had to do like an experiment with ourselves. And maybe I'll talk about that later, kind of how that went for me. But my pH most of the time stays pretty neutral because I don't eat a lot of fermentable carbohydrates. I don't eat a lot of simple carbohydrates and simple sugars that can really put my mouth at a very low pH level. So keeping your mouth at a neutral pH is super awesome for the overall health of your mouth and to prevent cavities. So every patient that I treat in clinic will get a pH score from me. So we had to do that on each other. You pool the saliva in the mouth, stick a pH test strip in, and then you read what the level is based upon what color shows up. And the more acidic your pH is, the more yellowy it looks. And the more basic or neutral your pH is, the darker it will look. So that's kind of the thing we use in clinic to do that. And that was mainly week 1. I don't think there was really anything else. We talked about fluoride and rationales behind fluoride, how the different fluorides are administered, different clinical fluorides, to fluorides in people's toothpaste, to fluorides in mouthwashes, to prescription fluoride treatments, to toothpaste with prescription level fluoride in it for high-risk patients and stuff like that. So that was pretty awesome to learn about that. Week 2 is where we really learned the clinical applications. Again, looking and understanding Provisor, which is our main, portal for which we do a caries risk assessment on our patients. We ask a patient a bunch of questions. What do they eat? What do they drink? Do they do this? What is, how is their socioeconomic status? How often do they brush? All these different factors that really can contribute to a person's cavity risk or risk of having caries. And we get a score for them. So like if you're like at a low caries risk, your score is going to be 0 to 1. If you're at a really high caries risk, you're going to be 4 or 5 or 4 or 5. And that classifies you into high, moderate, and low. And then we also got like this very basic treatment planning guide for caries risk for people that are, kiddos to adults here, as you can see. So, which is super duper cool. So like somebody who is above age 7 with a very low caries risk, there's really no reason to do a fluoride treatment unless they are still erupting new teeth. The main thing and then we can also discuss home treatment. Make sure there's enough fluoride in the water. Make sure they're using fluoride toothpaste, maybe a fluoride mouthwash to kind of make sure they're continuously getting fluoride. For people with a high caries risk, we're definitely going to do fluoride varnish application. Sealants are a huge thing. And actually it says fluoride varnish application at 3-month intervals. So they may be coming in between cleanings to get this fluoride varnish. Home maintenance, obviously, eliminate the sugary drinks, increase xylitol consumption, increase the level of fluoride water consumption. Make sure you can even do things like doing a chlorhexidine rinse, which basically reduces the type of bacteria in the mouth that contribute to cavities, and there's actually only 2 types of bacteria. There's a lactobacilli and a streptococcus mutans. So using the chlorhexidine will actually help eliminate the amount of bacteria that are growing or will slow the growth or even kill the growth of those types of bacteria in the mouth. And then we learned, like I said, about white spot lesions. Like those are the things that aren't necessarily cavities, but if they go further into the demineralization process, they're going to eventually turn into cavities. So just because you have demineralization present or areas of watch doesn't mean you're going to have cavities. As a matter of fact, Very hard for me to show you, but I have 3 areas in my mouth that are more watch spots. I have a stain on one tooth, plus I have 2 little areas on the cusp tips of 2 of my very, very back teeth that are kind of starting to look like they might turn into a cavity. However, they are not soft. But that is a watch area for me to really focus on, hey, make sure I'm getting enough fluoride. Hey, you know, maybe a fluoride varnish would be applicable for me now. Making sure there's enough fluoride in my drinking water, stuff like that, that's really going to stop that demineralization process from happening. And just because you have an area of watch or a decay area doesn't mean that it's going to turn into a cavity. It's just an area that they're going to want to take a look at that could eventually turn into one. So just because you have demineralization present in certain areas of your mouth or areas that don't look quite normal doesn't mean that there actually are cavities. And then we learned how to classify caries by location and kind of what they look like by a classification called G.V. Black. I believe he was a dentist way, way back in like the 1900s. And I think he came up with this system, and then obviously he named it after himself. But there's class 1 through class 6, and it is based upon where they're located in the mouth. So I'll just kind of show you this guide. I won't go through and explain it. Like, I kind of understand what it's supposed to be happening. But as you can see, like, the back teeth, you know, in more of the chewing surface is called class 1. The back teeth more in between where the teeth would meet would be a class 2. A class 3 would be like the sides of the front teeth. A class 4 would be the sides of the front teeth, including the edge part that you can touch where you bite down. Which would include the incisal edge. So there's not much difference between a class 3 and a class 4 other than one more includes the edge. And then you have class 5, which is at what we call the cervical third of the tooth, which is the part of the tooth that touches the gum tissue. And then class 6 is specifically on tips of teeth, like a cusp tip or an area that's a higher up portion of the tooth. So like on your molars, you have several cusps, which are kind of like the top parts of the teeth. And if there's a little cavity started there, we would call that a class 6. So that is about different things. And then I have a guide here for different pH ranges for different foods. Again, we went through more G.V. Black classification. And then we also really went through and understood that there's more than just x-rays and feeling around for cavities that can really help aid in cavity detection nowadays. There's actually different devices that can actually understand, like, I guess can really... The technology can get an idea of like what a healthy tooth is, and then you can actually put this technology on a tooth that you might think has decay, and it can actually kind of get an idea of getting the idea of the density of the tooth and stuff like that. What tooth is clinically sound, what tooth is not clinically sound. I don't think we're going to be using really any of that at my college, but we need to be aware of these devices that we might be able to be exposed to as hygienists if we go work in an office privately eventually. And then we did, like I said, we worked on a project on xylitol. And then we got to also understand the background behind how biofilm forms, what role does biofilm play in cavity detection, what does pH play a role in. And actually, there is critical pH levels for each part of your tooth. There's enamel, dentin, and cementum. And the further down inside the tooth you go, the less acidic of an environment you need to start causing demineralization. So your enamel, you need to get pretty acidic for your enamel to actually start demineralizing, 5.5. But areas like cementum, which is basically the covering that covers the root surface of the teeth below your gum tissue, you'll need a 6.7 pH, which is almost neutral. So people that have really receded gum lines or have exposed root surfaces are at a very high risk of having cavities, because the cementum that covers that root surface, it doesn't take much of a drop in pH to start that demineralization process. So that's something we really need to be aware of and understand, that like the further down into the tooth structure you go, the more prone it is to having cavities. And also the further down into the tooth structure you go, the less mineral content there is. And if there's less mineral content, that means it's going to be a lot more susceptible to having being prone to cavities. So we had to understand that. We have to understand the metabolism behind how bacteria metabolize the sugars we eat, and that's what causes acid production, particularly lactic acid, which then again gets squirted all over your teeth surface. And if you're constantly having an acidic environment or constantly snacking on sugary things, that is going to continuously put your teeth under acid, which again could lead to demineralization and eventually cavities. And oftentimes cavities aren't going to form overnight, and they're actually not going to form overnight. This process might take months, it might take years to get a cavity somewhere. As a matter of fact, the one stain I have on my one tooth, I had a very similar stain on the opposite tooth, on the opposite side of the mouth, on the same arch. And they filled it last year because they really weren't sure if it was soft or not. Now, I kind of feel like I got gypped out because, quite frankly, my dentist rationale wasn't quite there. She's saying, I think it is, but I'm not sure. Well, you're the dentist. You really should know and understand, like, hey, is this really something I need to be fixing? Or is this something that I can really be watching? But they fixed it anyway, and they don't know if it was cavitated, but now I have a composite filling right in that area. I actually have a few restorations in my mouth, but they're all composite, they're all tooth colored, and they're all very small because they caught those areas before they turned into areas that were huge. I never needed any numbing medication to have my teeth filled, which is super nice. But I was kind of like, if you're going to fill the one side, why don't you just fill the other side then too? Because obviously you don't know what the heck you're doing as far as like, oh, I think it may be starting to turn into a soft area of decay, but I don't know. We're going to fill it anyway. Why don't you just fill the other side to make it cosmetically pleasing to me? That's my theory. But I have other little fillings in my mouth from when I was younger, and obviously the younger you are, your toothbrushing habits aren't going to be as good. And I think they're all like on my back teeth, except one of them I think is in the front. But all mine are tooth colored. I actually know where they are based upon they're just slightly different than my tooth color, and I can actually feel them with my fingernail. And if anybody takes a dental instrument, they can tell where they are located. Also by X-rays, they'll show up. But they can tell where they are because they have a totally different texture to the tooth surface, which is something else that we have to be aware of, and checking around different restorations, because previous restorations are also at a high risk of getting cavities. So understanding pH levels, how they dip and go down, different things like that. One of the final things that we were talking about was like you can actually overdo the amount of fluoride that you do. There is safety tolerated dose and the clinical lethal dose. The older you are, the more you can handle at one time as an adult. That's why we don't recommend swallowing toothpaste, stuff like that, so that you don't overconsume it. And actually, people that have fluorosis of the teeth are overdoing the amount of fluoride they're getting, and that could be from over excessive amount in drinking water to overdoing fluoride treatments or whatever in an office. Typically not, but most of the time it's continuously at home, and their teeth can actually kind of look corroded after a while. Now, it's not like it's a bad type of corrosion, but it's not going to look aesthetically pleasing, and their teeth are going to be so hardened from all this fluoride that is not, like I said, it's not going to look very good, and it can actually look very funny when they chew and bite and stuff. So you can overdo fluoride. I don't know if I can show you guys a picture, but dental fluorosis looks like this. It kind of starts looking corroded, and again, that's just a really thick layer to the enamel, and or a thickened matrix to the new tooth structure, because when you add fluoride to the original tooth structure, it actually makes it harder than what the original tooth structure actually was. So if you are overdoing the amount of fluoride, you're going to end up having issues with different things related to how thick that matrix is going to grow. And then understanding the difference between fluoride and decalcification of the tooth. Fluorosis is mainly going to be on the part of the tooth that you chew on. Decalcification is going to be located where the tooth and the gum tissue meet. So it's understanding that location as well. And like I said, I really love this class, even though it was short and accelerated. I think it's really, really applicable to what we do clinically, and I think this is going to be a lot of fun understanding the whole entire process of caries going into my next clinic level. So anyways, I hope you guys enjoyed this video. If you did, give it a big thumbs up. Feel free to hit that subscribe button down below. I post videos every single week about diabetes plus more. I will be doing a semester 2 update when that is over with in May here. I do start semester 2 January 27th. So we're going to get cooking, and we're going to keep going on with dental hygiene school, and I will keep making videos for you guys. I've got lots of great things coming out for you, and thank you again for all your love and support on this YouTube channel. I am still getting a lot of feedback and comments for how much help I've given people, and it just touches my heart to know that I have inspired a lot of you to take care of yourselves and be the best version of yourselves. So anyways, until next time for another video, take care, God bless, be kind, spread positivity, and be thankful, and please brush and floss your teeth. You don't want to end up with decay on your teeth. Don't get any restorations. Come on now, keep your oral hygiene habits good, says the student dental hygienist. Bye, everyone.